to be on the screen?
I have it.
No, I got it.
Okay. All right, everybody, we're going to get started again. Thanks for keeping this break short so that we can have the opportunity to dive in with our next speaker, our next guest. I am really, really excited to welcome today Ms. Kayla Williams, who is the Assistant Secretary for Public and Intergovernmental Affairs at the Department of Veterans Affairs. Kayla, welcome.
Thank you so much for having me.
Awesome. So we thought it would be really interesting to talk to you, given that the conversation today has been all around the various types of media that impact military and veteran communities, and certainly media surrounding VA and its work could not be more important for veterans to see and hear and know and understand. So first, why don't we start off with, you are relatively new to this role. So can you share with us a little bit of your background and how you came into the Assistant Secretary role where you are now?
Yeah, sure, absolutely. And I'm not only new to this role, but I'm new to public affairs. I do not have a public affairs background at all. I served on active duty in the Army for 5 years as an enlisted soldier after having already gone to undergrad and gotten a bachelor's in English literature. After my 5-year enlistment, including a year-long deployment to Iraq, I used my GI Bill to go to grad school, got a master's in international relations, then realized I did not want to do international relations, and ended up working at RAND, which is a think tank, for about 8.5 years. And while I was policy and international relations in the direction of my copious free time, I was doing a lot of advocacy because as a woman vet, we just apparently philosophically don't believe in having free time. We have to fill every waking moment with things. So I was advocating on behalf of military women, women veterans, wounded warriors, caregivers, and so forth. And I shifted to align my personal and professional work a little bit more. And that need to ensure that what I was pushing for was actually evidence-based instead of just like, let's throw a lot of spaghetti and taxpayer dollars at the wall and see what sticks, became more and more important to me. I also started to feel like the good idea fairy, like working at a think tank, like here are all these wonderful things that you should implement, and I will flutter off and leave the work of implementation to somebody else. So when I was offered the opportunity to go into VA last time to run the Center for Women Veterans and try to drive change from the inside, I was really excited about doing that. Spent a couple years doing in that role. Then part of the administration change, left and went back to the think tank world at the Center for New American Security for a couple of years, running the Military Veterans and Society program there. And now I'm back in VA at this role. And when I was, thinking about would I be willing to go back in to government, to VA specifically, and what role would I most want, this was the role I wanted the most, because I knew from my experience as an author and my experience at RAND that telling important stories is hard, and that VA has a lot of amazing stories to tell. And I thought that I could potentially have the opportunity to make a lot of impact in this particular role. And I wanted to come in and change the relationship that we had with the media and try to do a better job of conveying complicated and difficult information to a public that really needs to know it.
Yeah, I was going to ask you if it was a hard sell to get you back to VA, but it sounds like not so much for this role in particular, but maybe still a little.
I will admit that I had to think about it very hard.
Yeah.
It's as much as there are some folks who talk about, government bureaucrats and act as, I have never worked harder in my life than in the government. both when I was on active duty and then working inside VA. I work longer hours. I work harder. I'm more emotionally invested, and the pay is frankly worse. So it was really difficult to say, okay, still in the middle of a global pandemic, still dealing with my kids virtually schooling, I'm going to make the decision to lean in and go back into work that can be, well, those who choose government service aren't always well regarded. And so it was a difficult choice, but one that I felt really compelled to do. And frankly, my spouse told me that I had a moral obligation to be willing to continue serving. And so did make the leap to come back.
Yeah. Okay. So you say that, you don't have a public affairs background. By the way, also an English major. Love that. I also love that most English majors, sort of have to go on and get the other degrees, because otherwise it's like, okay, we can teach. But if you don't want to do that, yeah.
Well, and teachers have master's degrees in teaching.
Yeah.
But go liberal arts in general. Synthesizing disparate pieces of information, being able to communicate clearly and articulately. These are life skills that are very important. Yeah,
writing in particular, certainly. So you don't have a public affairs background, but talk to me a little bit about, what you saw as you were contemplating taking this role, and as you stepped into it. What did you think were the biggest and most critical challenges in public affairs at VA? I mean, obviously it's a huge agency. The scope of what it does is mind-boggling, even to people who know it well. So talk a little bit about the challenges that you kind of knew you were going to have to deal with head on.
I think the first challenge that I perceived was the need to do a bit of a reset, because the goal that I walked in with was to transform our posture to one that is proactive, transparent, and accountable to the maximum extent possible, to really communicate that I have a deeply held belief that journalists are an important part of democracy, and they help to ensure that we are performing our mission and communicating the reality of what's going on to the general public, to veterans, to Congress, but shifting that focus to one that really acknowledges that important role and that partnership was probably a bit of a change from the folks who preceded me, and having to rebuild some trust. That I thought was going to be a really important first challenge to take on. And I listened attentively to your last panel, hoping to get any hints of whether or not I was succeeding at all in that effort. But I really that core philosophy, communicating across the board that journalists are professionals and play an important role that we value, and want to be responsive to the maximum extent possible was my first and remains my foremost goal.
Yeah, and that's a big one. And that really encompasses a lot in terms of how you approach that. And I guess given that very large undertaking of rebuilding trust and really focusing on proactivity and transparency, as well as accountability, how do you decide where to start? How do you decide where to focus your efforts, how to achieve maximum change as quickly as possible, but in a quality way?
One of the first things that I did was to reestablish that I believe in the public affairs officers in the field and do not need to review every single thing, recognizing that I am taking on some personal risk by delegating more decision-making down, but that my personal belief is the risk of having a story go out with no comment from VA because it took too long for me here in DC to approve something coming, from out in the field was greater than the risk that I might have changed a happy to a glad. for example. And, I mean, there are other risks as well, but that was the core, to say, like, look, we've got folks out in the field who have master's degrees in public affairs. They have been in these communities for a decade. They have relationships with the local press. Those personal relationships, as the last panel talked about, so important. And I want to encourage them to do the jobs that they train to do and want to do, and provide them with tools to support and encourage them, but not exist exclusively as a bottleneck.
Right. No, that's, and as a former VA field employee, that really, rings a bell for me. It is, again, that huge apparatus that VA is, can sometimes get bogged down in that. Can you talk a little bit more, without getting too far into the weeds, about how your office and your crew work with those public affairs professionals in the field and their various contacts?
So the chart that would explain that, the PowerPoint slide, looks almost as ugly as some of the slides we see from DoD with all the lines.
Okay, fair.
But overall, we have the ultimate authority, and VA remains in many ways a siloed organization. So I'm here in central office, and the Veterans Health Administration, Veteran Benefits Administration, and National Cemetery Administration all have their own comms shops, as do a number of staff offices and program offices. And there is no way that any single person, in my professional opinion, could know every single thing that every single communications professional in the Department of Veterans Affairs is doing on a given day. It is just too much. I mean, a massive organization, millions of beneficiaries, thousands of locations, hundreds of thousands of employees. So the goal for me, as I see it, is to broadly set the policy, the direction, the overarching guidance, and ensure that folks know which topics are worth elevating and which they should feel comfortable addressing at the local level, and being willing to again bear some of that risk, but try to empower people with the tools and materials that they need to be able to answer questions that they're getting, and trying again to open up access to subject matter experts. Like, we have amazing professionals with decades of experience in their fields, and we want to help them feel comfortable talking directly to journalists instead of trying to translate what they're saying and serve as a barrier. And again, the decision to go in one direction or the other, I think every leader is going to fall somewhere different on the scale, but I've been trying really hard to make sure that we give people the opportunity to showcase the amazing work that they're doing, because people are doing some incredibly innovative, absolutely fantastic things, while also making sure that they're comfortable. There was somebody said earlier, if you do talk, you will hear from your public affairs officer. So yeah, do talk to us first so that we can give you the tools that you need in advance. If you go off without it, just like in the military, you will probably hear from your public affairs officer later. But we're really trying to be partners instead of obstacles. And I'm not trying to speak ill of my predecessors, just again recognizing that I have a slightly different risk perception and maybe a slightly different risk tolerance.
Yeah. And I think, it is my sort of assessment and understanding that, communications to and from VA, have been challenging for a while. And a lot of it is just, again, that size and scope. So it's not necessarily some kind of, super acute recent thing. It just is really challenging. But I love that, it seems like you are modeling those values of proactivity, accountability, transparency, but also empowering folks to use their expertise, which, you're absolutely right. There are some incredible people doing incredible work all throughout VA. So it's great to be able to hear their voices. A lot of people are nervous talking to, whether it's journalists or other members of the press or just the public in general. That's not something that everybody feels comfortable with. Does your office work with leaders and staff at VA to help them gain those skills?
Yeah, absolutely. And I'll note that I get that. I did a long form interview with somebody recently, and after talking to a journalist for an hour and a half, I was like, the chances of me having said at least one thing very badly are pretty high. So I'm going to have to trust that he does not make me sound absolutely terrible. There are risks, and so we do offer trainings to senior leaders, and we offer more general trainings to public affairs officers as well. So both at the national level and out in the field, we provide a lot of training and support. And I'm really hoping that the pandemic permits us to have a public a national gathering and national training summit next year again, but we'll see. I think we're all still in that waiting game, right, to see how the pandemic goes.
Yeah, but I'm sure there have been so many lessons learned during this time that would be great to share with that community if you can gather. So you mentioned that there are so many good news stories at VA, and I could not agree with you more. There's so much good happening there. How can good public affairs at VA help the agency to not just tell those good news stories, but actually execute on its mission? How do the two things work in tandem?
So Steve did such a good job at having really precise examples, and I wish I had one that is as perfectly timed for that question, but I'll give maybe one example. So a good news story that I'm really excited about right now that just broke on Saturday is that the secretary is initiating a change to the policy to allow gender confirmation surgery among transgender veterans. And the fact that we were able to break that news during Pride Month was really symbolic, which is meaningful to me. And one of the ways that I hope that getting that news out there can help veterans is by making transgender veterans aware of the fact that they'll be able to come in and get the full spectrum of healthcare at VA, right? Folks who may have not been getting responsive and culturally competent care, who may not have been able to get medically necessary care in the past, and may have accordingly been delaying getting other types of necessary care, knowing that they can come to VA and that we will be here to meet all of their needs. That's really important, because this care in particular can be life-saving. And so it can, I don't want to overstate it, but I think it can be literally life or death to make sure that folks know that they can come into VA to get evidence-based, culturally competent care. And that is imperative to get folks in. I'm talking a lot about healthcare, but it goes beyond that, right? I used the GI Bill to go to graduate school. I have a VA-backed home loan. I have a VA disability rating. So especially in this time of economic crisis, for folks to know that they can come to VA to get care, to get benefits, to get help with homelessness when we're facing the potential end of the eviction bars. These things matter a lot. And the press is an important part of our ability to ensure that the maximum number of people know what care is available. We would not be able to communicate with folks who are not enrolled in VA by ourselves that the Save Lives Act allowed us to vaccinate non-enrolled veterans as well as their family members and caregivers. Like, we need everyone to help communicate that information. And again, during the pandemic, that is life-saving information that we cannot by ourselves get out into the world.
Yeah, I think that was the first example that came to my mind, was in terms of that vaccine availability through the VA system and getting that message out to as many people as possible, as quickly as possible. Absolutely, makes a difference in terms of keeping people safe and healthy. So your office is not just the Office of Public Affairs, it's the Office of Public and Intergovernmental Affairs. So can you talk a little bit about the I in your work and what that entails, and what your assessment is in terms of priorities there?
So on the Intergovernmental Affairs side, we have an office that works with state and local partners. So organizations like the National Association of State Directors of Veterans Affairs, which is a mouthful, and county veteran service officers. We also have an office of tribal government relations that engages with federally recognized tribes. And again, wanting to make sure that we are working closely with our partners across the board to get out information about what VA is doing, and then also hear back from them. What's working, what isn't working, where do we need to improve?
Okay. Yeah, I think it's really interesting to tie the two together because, certainly people get a lot of information from the press, from all sorts of media, but there are these other organizations and services that veterans and their families use all across the country. And even though we may not always like to admit it, the world does exist outside of Washington, D.C. Having those partnerships at the state and local level is critical in terms of getting that message out.
And on the public affairs side, while I've talked a lot about the press, given the focus of this event, we also have a digital media engagement team where we're communicating directly with veterans and family members and anyone who's interested through social media and otherwise. And it's really been fun for me to get to know the folks who make some really creative and innovative products.
Yeah.
We have a podcast. We have some folks who do really great videos, and seeing, I am not terribly creative, so seeing creators do what they do really well is also super exciting.
Yeah, engaging with VA social media when I was working at VA, that was always really scary because, you put yourself out there and you make yourself available and you don't always, necessarily get warm and fuzzies back all the time.
What?
Shocking, I know. People have things to say. But engaging in that way, that's how a lot of people prefer to engage. Do you feel like you're able to still kind of take that kind of proactive approach when you're talking about something as kind of volatile as social media? Or how do you weigh kind of the pros and cons of engaging directly in that way?
I mean, we put out a ton of information on social media. Responding is probably a little bit different.
Yeah.
We're not Wendy's. Is it Wendy's? That has
Sir, this is a Wendy's.
Fun.
Yeah.
We're not Steakums. We are not as edgy on social media, but we do try to certainly at least monitor for crisis and need, and respond if we see anything that indicates that somebody needs an immediate referral to, say, the Veterans Crisis Line or something.
Yeah, absolutely. So I know you lamented not having examples handy, but either from your tenure or otherwise, what are the examples that come to your mind when you think about how good public affairs can really impact actual people's lives?
I think, as we both mentioned, the news about the vaccine is really important. I think also that when I see or hear about stories of people who learn about a VA care benefit that they didn't know they were eligible for, and it's able to turn their lives around, for somebody to be able to learn that they can apply for a discharge upgrade, start getting benefits, become housed, things like that without hearing the right information at the right moment, their lives might have had a really different trajectory. Another thing that I'll mention, not entirely related to your question, but one thing that I'm really excited about is that my team has initiated press conferences for VA. And as far as I know, VA never previously had a regular press conference. So the fact that we will be having monthly press conferences is it's a big change. And I'm really excited that we're able to make that move towards proactivity and transparency and accountability and being there showing up on a regular basis and being willing to answer questions. And that is something that is really exciting. We don't have a huge beat of journalists who cover us on a regular basis, but we do have a few dedicated folks who show up. And this is something that I was really hoping I'd be able to do if I got the role. And so I'm super excited that the secretary has been supportive and made himself available, and that we've been able to open up in that way.
Yeah, I was going to say, I know that there was a lot of conversation, about that in the past in terms of why doesn't VA have that? DOD has it, these other places, agencies, organizations have it. So that's an exciting step, I think. Scary also.
I'm super proud of the team for making it happen.
Yeah, absolutely. What other specific goals do you have for your office, for your work, in as you look towards the future of what you're doing?
Well, since I'll have accomplished that big one of monthly press
check.
conferences.
Press conferences, check.
I just quit. I'm kidding. I would love, this is the nerdiest, worst answer that I could possibly give you. I would love to figure out a better way to measure success for my office.
That's an intriguing answer to that question. I'm going to agree that it's nerdy, but I think it's an awesome answer. Tell me more about what that looks like.
Well, so we have the Veterans Experience Office, which measures the veteran experience and measures the employee experience. And like, we really pay close attention to things like trust and how do veterans feel when they come to VA. So we have a pretty good sense of whether, like, how is VHA doing in meeting veterans' healthcare needs? How is VBA doing in serving veterans when they come to get benefits? Everybody knows that NCA does a phenomenal job and better than like any other organization in the entire country in customer satisfaction for family members. But for our shop, how do you know if you are meeting customer needs on the public affairs side? And who is my customer? Should I be serving Dan and Steve and
I was going to say
others?
some of our previous panelists may have thoughts on that.
Right. Like, but is that my customer and who I should be serving on how well we're doing our job? Are we being responsive enough and timely enough and polite enough? Or is our customer media consumers and the journalists are just a pathway to them? And then how would we measure? So trying to think through, like, what are the measures of success and what are the best ways to, track it over time to grade my homework, to see how well I'm doing. Like, that is something that I think is difficult. Like, it's not enough to measure how many social media posts we put up. It's not even necessarily enough to measure the engagement with them or the response with them, which is a different measure, but also important, but not, it still doesn't tell you whether or not it's affecting long-term change or moving the needle on public opinion. And so it's really, I think, a kind of a wicked problem. Like, public perception of VA, yes, hopefully if I do my job really well, it will improve. But if the stories that we are communicating are really bad, then it doesn't matter how well I tell them, right? So I just feel like that measurement challenge is a tough one for me. So that's a horribly nerdy, again, answer to your question.
No, I love it. And it strikes me that figuring that out requires a lot of patience, because a lot of the things that you're wanting to measure and track, long-term impact, are you making veterans' lives better? That's a long game. You're not going to have metrics on that, in a month or even maybe a year or more. So yeah, you have to really not only hone in on it, but also then allow the data to aggregate.
I think it's a question for all of VA too. Like, I'm concerned about it from my shop, but I've talked to folks also about how do we measure success for VA? Well, if I use my GI Bill and get a private sector job with amazing insurance and don't go get VA healthcare anymore, is that a win for VHA or a loss for VHA? Like, right? How do you measure, how do you ultimately measure success if VBA does such a great job that people are not using VHA? What's the score for VA? Knowing that most people only think of VA, don't differentiate. But that type of question, how do we measure success for the organization, is also, I think, a challenging one.
Yeah, good luck with that. I mean, but it's so awesome that you're thinking about that, and again, it goes back to that accountability piece in terms of making sure that you can, tell the story of what you're doing in terms of telling stories. I know this is not a VA press conference, but are you able to to take questions from the audience?
I am happy to take questions from the audience.
All right. Well, I'm going to open it up and see if any of our audience has questions. Really? All right. There we go.
Hello. Hey, my name's Ashley. Thank you so much for being here today. I'm one of the HillVet proteges along with cohort 5. Question on how your office, if it is, tackling extremism and the views of veterans as a part of this rise in extremism in the United States today.
One of the areas where we've been really focused is recognizing that disinformation and misinformation can be a part of this challenge. For us, is getting out accurate information and ensuring that that's in folks' hands to the maximum amount possible, and also ensuring that folks know where to come if they are experiencing any life challenges that are maybe making them a little more vulnerable. So getting them connected to resources and connected to other veterans. We have peer support programs, for example.
All right.
This gets back to your question. Oh, Lou Feynman, by the way. This gets back to your question on measuring success. So I remember transitioning out, and one of the things that I was looking forward to and being a veteran was not having to go to Navy Health anymore for my own healthcare. And so, I had a reticence to, using the VA for healthcare because I thought, oh man, there's like, the world is my oyster now, and I can kind of go wherever. Now I'm very blessed again and fortunate that I was in a situation. I transitioned to reserves so I could get healthcare through the reserves. I was also working for a very good private company that offered great benefits. So kind of getting to that of measuring success, but also, how do you kind of counter that bias for folks like I had coming out, where it's like, hey, one of the benefits of getting out of the military is I don't need to go here for healthcare anymore, but it's a benefit that you provide. So just if you
So
I've
used private insurance. I've had military healthcare. I choose VA healthcare now. And I can tell you that I love VA healthcare because it is totally integrated and easy to use. I'll give you an example. When I was not going to VA and using insurance, when I was pregnant, I got an ultrasound in my OB's office, and it turned out that the person who did it was not covered by my insurance. And so I had to pay for it out of pocket, even though it was in the same exact room where my provider by insurance. But apparently I was supposed to know to ask, are you also covered by my insurance? Never occurred. Do not have that problem in a VA hospital. Walk in the door at VA and everyone I see is covered. I don't have to worry that the lab in the same building is not covered, which also happened to me with private insurance. I don't have to worry that if I am given a boot when I break my ankle, that it won't be covered. Also happened to me with private insurance. So like that's what I love. I will also share that when I was not coming to VA, I would go to a regular doctor for like, oh, I think I have strep throat. And I would go to a women's health doctor for, let's say, bikini zone care. And they did not have the same healthcare, the same computer system. So my primary care doc is like, do you promise that you got your pap smear? And my women's health doc is like, do you promise you got your cholesterol checked? And because they could not both see the same system. And then if I got mental health care, entirely different system, could not see any of my labs. Nobody would know if I was on medication, right? So all these different systems. And in VA, I have integrated healthcare. I have a patient-aligned care team. They're all on the same system. They're all seeing the same picture of the care that I'm getting. And that integration, nerd alert, leads to better healthcare outcomes, which has been very well documented. But it's also easier and more convenient and better for me as a patient. I don't have to go in and schedule a different appointment for my women's health exam as for my regular annual physical. It's all one shop, all in one location. Also, I can say that the cultural competence really matters. Like VA screens for military sexual trauma. They screen all patients. And my doctor in the civilian sector, before I switched back to VA care, like would not have known what military sexual trauma meant, much less known to screen for it and ensure that they're giving me care that's being like responsive to my military specific exposures. I have a dear friend who was pushed to get a mammogram when she was in her 30s by a VA doctor who said, where you've been stationed, you need to get a mammogram. And unfortunately, was diagnosed with breast cancer, but that's not something that her civilian provider had ever said, like, oh, in your 30s, you should be getting a mammogram already. So come to VA because we have evidence-based, culturally competent, high quality, integrated care.
Oh, there's a follow-up. All right.
Yeah, no, fantastic answer. And I also apologize because maybe I asked the wrong question. I guess more in lines of how do you get that message and what's the VA doing to get that message to folks who are currently in the military that are thinking, hey, you know, I kind of can't wait to get away from, you know, Big Brother telling me what to do all the time, and knowing that this benefit is there. You know, most veterans in the room have gone through the transition assistance, you know, program at least once, sometimes more than that. So that was more toward my question is kind of getting the message to kind of the benefits that you were talking about.
Yeah, that's a great question. I know on the women's side of things, the Air Force initially piloted a women-specific TAP component that focused more on VA and would go and tour a local VA medical center and help women vets know that VA provides healthcare for women, because a lot of folks assume that it's their grandfather's healthcare. And that proved to be really, really successful. It's now spread and gone more, it's gone nationwide in all branches of service. And I think that that shows a great model of how to potentially see if that can be driven further and expanded we'll see. I am not promising anything. I'm saying I think it's an interesting model that has proven success among women. And the more that we can engage early and often to help raise awareness, the better it is. Another example of something that I saw worked, that exposure that opens people's eyes, at the summer sports clinic out in San Diego a few years ago when I went. It's just amazing. We had, for example, I saw women veteran double amputees learning to surf. Like, you'd not get that from private insurance. Like, this is something that you get at VA. And there were a lot of volunteers from the local military installation who were there to help. And all of them were like, I had no idea VA did things like this. This makes me more likely to come to VA because I now know, I can see that I'm going to be taken care of really well, that I'm going to have these opportunities, these experiences, and just get really high quality care from people who are really passionate and dedicated to caring for veterans. So finding various ways to, get that information in front of active duty service members and reservists and National Guardsmen, of course, to let them know about the high quality care, how integrated it is, all of the amazing wraparound services that, again, you're not going to get in the private sector. My spouse is a combat wounded veteran, and he at one point was doing rec therapy, where we had 2 kids under 2 at home with us, and he went to golf for 3 hours every Sunday for months. And I was like, oh, really? This is therapy, is it? Therapy. But it actually was really helpful, and I was very glad that he did it in the long run. But how many folks know that you can go golf with a cohort of other veterans and learn like stress management techniques from folks in that kind of setting? Like, this is a really cool thing that we offer that you're not necessarily going to get anywhere else.
As we kind of wrap things up, I think kind of related to this question, the folks in this room, veterans, family members, folks who still are on active duty or in the Guard and Reserves, policy people, all sort of walks here. How can we, how can they, how can, this group not only make sure they're getting all the most up-to-date information about VA, and how can they be good partners in, kind of doing what you're talking about just now with Lou, getting that information out to other folks?
You can follow us on social media and retweet and share our stories. There's a vet resources email, which goes out to like 10 million people when it goes out. And that has a ton of fantastic information in it. So signing up for that is good. And then sharing the information with folks who need to know it. I encourage folks to also share if you've had success. Like I tell everyone I've used my GI Bill, I've used my VA backed home loan, because I want folks to hear directly from me, like I am a user. I have done this. I put my body where my mouth is by getting VA healthcare. So sharing, I think a lot of us trust those personal stories. Like I'm a nerd, so I would love to show you all the data about how effective our care is, but I know that that doesn't necessarily matter to the layperson as much as those stories. So sharing those stories and experiences, and if you listen to a podcast that really clicks with you, sharing that, but making sure that you have a general sense of what care and benefits you're eligible for, and being able to pass that along to a friend if you think that they would benefit from it. If you have a friend who says like, oh my God, I'm recently unemployed and I have no idea what to do, being able to say like, have you thought about using your VA benefits to go back to school and increase your education level? Here's how you can apply. It's pretty simple now. Just having that in the back of your mind. I think a lot about how, like the population that we serve, we have folks who are, pretty high performing and maybe want to use their GI Bill to go to grad school. We have folks who are like doing okay and maybe don't need VA, but what we need for them to know is that we're here if their life circumstances change. And then we have folks who may be struggling on multiple fronts, who may be dealing with unemployment and a substance use disorder and are really going to need intensive services from multiple different angles. And how do we tailor our communications to all of those groups so that they know what's available to them now, or what would be available to them if their life circumstances changed and they needed or wanted different types of engagement or services from VA.
Yeah, very challenging to cover all of that ground, but really important. And I think everybody in this room can definitely take a role in passing the good word along. Any closing thoughts or info that you want our audience, both here and virtually, to know about the really important work that you're doing?
I feel a little flattered. I don't know how important it is every day. I mean, what I mean by that is that I'm lucky enough to work with a great team, and I hope that I'm making a difference, but really I'm just trying to empower them to do their work. I guess the main thing that I would encourage folks to remember is that your voice matters. I know the last panel talked about that too, in terms of like engaging with media. And I think it was Zach who mentioned the War Horse, where I've published as well. But as a woman veteran in particular, all of us have a story to tell, and I encourage you to find a way to share it. Your voice matters, and we want to hear from you. We, in the grand sense. So find a way to share your truth, because it's going to make a difference in somebody's life.
Absolutely. And, when VA is successful, that's nothing but good for this community. So we really appreciate you sharing with us some of your perspective, and thank you for what you're doing and for going back to public service. I've thought about it, and it's horrifying sometimes to think about it. So I know that those decisions, especially when you think about your family and everything else, those decisions are really difficult. But anyone who steps up to serve, we're very into it. So we really appreciate you sharing your time with us here today. Thank you so much.
Thank you for inviting me, and thanks to all of you, and good luck in your next steps.